Welcome, everyone. We're going to give it a minute or so for everybody to trickle into the room. Thank you for attending today. So we'll be getting started with the webinar in about 1 minute. All right. Well, good afternoon, everyone. My name is Steve Young. I'm one of the psychology advisors here in the psychology department at the University of Maryland. We're very happy to have you joining us today. We're really excited about our webinar for today. It's with Sheppard Pratt. Sheppard Pratt is a very large behavioral health system that is scattered all throughout the state of Maryland. And they specialize in a number of different areas. Of course, mental health services, addictions, special education, and community support services. They have a number of settings, clinics, and educational settings, again, throughout the state of Maryland. Just a couple reminders before we get started today that this session will be recorded. So if in the event you had to leave early, we will be recording the entire event for you to watch later. Very important reminder is our Q&A box that we encourage you to post questions throughout today's webinar and such. Another important item is our kiosk. So in the Q&A box is a kiosk link, and we ask you to complete the kiosk so that we can record your participation, your attendance today. So with that being said, I'm happy to introduce our exciting guest for today. Stephanie Coakley is the Human Resources Coordinator on the Talent Acquisition Team at Sheppard Pratt in Towson, Maryland. She has been with the company since January 2019, where she started as a human resources intern. After receiving her Bachelor of Science in Healthcare Management from Towson University in May 2019, she was hired as a human resource assistant and was promoted to her current role in March 2020. She is point of contact for college and university recruitment, focusing on clinical mental health roles. She also serves on the Sheppard Pratt LGBTQ+ Inclusivity Committee. Please join me in welcoming Stephanie Coakley.
All right, hi everyone. I'm Stephanie. I'm the HR coordinator on the talent acquisition team at Sheppard Pratt. I'm really excited to be here and talk to everybody about what our company does and different opportunities that we have either now or in the future. So I guess I will get started. So just give me 1 second. I don't know why my slides are not working. Oh, there we go. Alrighty, so sorry about that. Like Stephen had said, I'm the HR coordinator on the talent acquisition team. I focus mainly on recruiting for hospitals. We recruit mental health workers, which I'll talk a little bit about. We recruit for social workers, we recruit for nurses, and just different positions throughout the hospital. I did start at Sheppard Pratt in January of 2019. I was in my last semester of my bachelor's, and I was required to do a full-time internship. I knew that I wanted to go into HR. I knew I really cared about mental health, so it made perfect sense for my site to be at Sheppard Pratt. So I was there for about 4 months, and when I graduated in May, I actually got hired as the human resources assistant. My role in that role was I sat at the front desk and I answered calls, and I also handled our entire onboarding process. So making sure that everybody who was hired had their paperwork, that we did background checks, different things like that. Right around the time that the pandemic started to get really, really crazy, I somehow was promoted into my current role on the talent acquisition team. And I am the point of contact with the college and university career centers across the state of Maryland. So what is Sheppard Pratt? In case you don't know, we are the nation's largest private nonprofit provider of mental health, substance use, special education, developmental disabilities, and social services. We were founded in 1891, just as the hospital that we have in Towson. And now we have grown. We have over 160 programs throughout the state of Maryland, and we have programs in 16 different counties. We serve over 80,000 people per year, of all ages, from infants all the way to geriatrics. Currently, we have two hospitals. There's the main hospital in Towson, and we also have another hospital that's in Ellicott City. We're actually in the process of building a new hospital that is going to be in Elkridge that will replace the Ellicott City Hospital. It's going to be really awesome, state of the art. We're hoping that it opens in 2021. The U.S. News and World Report has named Sheppard Pratt Hospitals one of the nation's top 10 psychiatric hospitals in the nation. Like Stephen had mentioned, I am on the LGBTQ plus inclusivity committee. Last year, we participated in a survey that is run by the Human Rights Campaign Foundation in something called the Healthcare Equality Index Survey. This survey measures how inclusive healthcare organizations are of the community. And we earned the LGBTQ Healthcare Equality Top Performer designation. It's something I'm really proud of, especially with us working in mental health. We realized that we had a need for improving our inclusivity of the LGBTQ plus community. So definitely something really great to know. So our mission and values, our mission statement is to improve the quality of life of individuals and families by compassionately serving their mental health, addiction, special education, and community support needs. We have 4 different values. They've been our values throughout the entirety of our organization's life. It's to meet a need, to lead, to care, and to respect. We're very big on making sure that we are aware of these values, not only when we're interacting with our patients and our clients and our students, but also when interacting with each other and our coworkers. So definitely something really great. So what types of services does Sheppard Pratt provide? So we have a variety of different services. I could never list all of them, but I think that these are some pretty good categories that will give you a good overview of the types of services we have. We have crisis services, we have in-person walk-in clinics, but with everything going on with the pandemic, we realized there was a need for a virtual walk-in clinic. It opened about a month and a half ago. So we have that as well to make getting mental health care more accessible. We have residential programs for adolescents and adults. Our adolescent programs are for adolescents who have either behavioral issues or mental illness. Our residential programs for adults kind of focus more on adults who have intellectual or developmental disabilities. We have programs for people who have previously been incarcerated. We have programs for helping them find a job, helping them get back on their feet. We have different Head Start or preschool programs. We have different programs for domestic violence survivors. We have shelters. We have different programs to help them through the process. We have 13 different day schools. They're for students with autism spectrum disorders, behavioral disabilities, and intellectual disabilities. After the pandemic, we started in March, we went virtual, and we have been virtual ever since until about a week ago. We were actually able to start to open some of our schools. And most of our schools are 12-month programs. So all of our teachers and our employees have been working virtually during this entire time. It's something that I'm really proud of them for, because it's definitely been very different with the pandemic. But they were able to start opening the schools, which is very exciting. We have different veterans housing and other services. All of these programs are grant funded. Right now, we just got a major grant for buying an apartment building down in Baltimore City that we're going to use to give housing to veterans who are homeless. We have different employment programs, like I mentioned, with the people who've previously been incarcerated, but also for teen mothers and just other people in the community. We have different in-home care programs. Something I recently found out about is we actually have a program where the therapists in these programs go and visit their clients in their homes and kind of know what to do if they are in some type of crisis. Like I said, there's so many programs. I could never name all of them, but that's just a pretty good overview. So the thing that I would say I am most familiar with is our Towson Hospital and our inpatient units. So I'll just kind of go over the different units that we have. We have our adolescent female and adolescent male crisis stabilization units. We also just opened an co-ed adolescent mood disorders unit. We have a child and adolescent neuropsych unit, which is for children and adolescents who are on the autism spectrum. We have a child unit for children between the ages of 4 and 12. Our co-occurring disorders unit is for people who are not only struggling with mental illness, but also with substance abuse. We have a crisis stabilization unit. Most of the times they're referred to us from one of our crisis walk-in clinics. Our geriatric unit is for people over the age of 65. We have our intellectual disabilities and autism unit, which is one of our most specialized and our smallest unit. All of the patients have intellectual disabilities or they're on the autism spectrum. Most of our units have about 18 to 22 beds, but this one has only 7. The staff works a lot more one-on-one with these patients. We have our psychotic disorders unit for adults with psychotic disorders. And our young adult unit is for people between the ages of 18 and 30. These are some of our other additional inpatient units and other programs. We do have an Ellicott City Hospital where we have 4 different units and a day hospital there. So we have our adolescent unit at our Ellicott City Hospital. We have an adult day hospital in Towson. We have our different adult residential programs throughout the Frederick County. Our Ellicott City Hospital also has an adult unit and a co-occurring disorders unit. We have a child and adolescent day hospital at our Towson campus. This is just when people come in just for the day. They're there for the entire day, Monday through Friday, but they get to go home and be with their families every night. Our Fenton unit at Ellicott City is also for adults who are struggling with different psychotic disorders. We have our Man Residential Treatment Center. This is a residential program for adolescents who have different behavioral issues or struggling with mental illness. We have our Sullivan Day Hospital at our Towson campus. It's another adult outpatient program. So they come, they're there for most of the day, but then they get to go home that night. We have our Center for Eating Disorders at Sheppard Pratt. We have 2 different programs for this. We have a day hospital where they're there for part of the day or all of the day, but we also have an inpatient unit for people who are between the ages of 12 and I believe 35 who are struggling with eating disorders. We have the retreat at Towson, which is one of our versions of what other facilities might call a halfway house. It's a really small program. There's only 8 people in it. And then we have our trauma disorders unit, which is one of our most nationally recognized programs. It's for adults who have experienced major trauma. We see a lot of veterans on this unit. We see human trafficking victims on this unit and just other people who have gone through different types of trauma. So I want to talk a little bit about some of the positions we have at Sheppard Pratt. If you're thinking about things for now, if you're thinking about the future, these are a few of our most common psychology positions in our hospitals. And these are the positions that I mainly help recruit for. We have our mental health workers, and that's pretty much our entry-level position. They're direct care positions. They work directly with our patients. They help them with their day-to-day tasks. They make sure that everybody is being safe. They help to lead different group therapy sessions, and they work with other mental health workers to come up with different unit activities and events. One example is last year, the child unit actually for Halloween went trick-or-treating throughout the hospital. So it was really great. They went to the different departments. It's just an example of one of the events that we do. And they get to work with the treatment team, which is our social workers and our nurses, and they actually get to give input on the patient's treatment plan. So if you're looking to ever work directly with patients, this is a really great place to start. We also have our discharge coordinators. They help with our patients when they're transitioning out of the inpatient unit to go to different outpatient programs. So they have to have knowledge of all of the Sheppard Pratt programs that we can offer to them, but also outside resources as well. They draft the aftercare plan. They go over it with the patients and their families. They make sure that they understand it. And they even follow up a couple days after their discharge to see what their progress is. So this helps with working with the patients and families, easing their transition. A lot of times our mental health workers get promoted into these positions. Typically, you need at least a year or two of experience first. And then we also have our social workers. We hire, depending on if you go into social work or counseling, we hire LMSWs or LGPCs if you are thinking about going into social work in the future. They conduct individual, group, and family therapy for the patients. They develop a treatment plan. They track their progress. They assess their needs. They assist with goal setting, and they work with the patients to implement a safe discharge plan. So another question I get asked about a lot is our volunteer opportunities and internships. And I think along with every other industry, we have been severely impacted by the COVID pandemic. So right now our volunteer and our internship programs have been stopped. We're hoping to bring some of them back in some capacity. The conversation has been started about how can we possibly do a virtual internship, but haven't really gotten anything off the ground just yet. Our most popular internship program is our counseling internship. The interns get the opportunity to assist staff with socialization activities. They encourage resident and patient participation in their different activities during the day. And they get to work with the staff on the unit to actually shadow what their day-to-day tasks are. Currently, Sheppard Pratt is only offering internships for students who are looking for credits. But during non-COVID times, if you are interested in volunteering, then we always can have volunteers on our inpatient units and in some of our other programs. Like I said, we're starting to talk about how we can safely offer unique internships. Some of our community services are working on it as well. We're also trying to build up our mentorship program. Nothing has really been set in stone yet, but right now we're kind of in the process of working on identifying professionals who would be interested in speaking to more students about their career paths. It's something that I feel is really, really important. It's why I do things like this presentation, and I do a lot with my past bachelor's program with their department. So it's definitely something we are working on. It's just kind of started. Another question I get asked a lot is, what do recruiters and managers look for when they're hiring? For a lot of our entry-level positions, we don't necessarily look for experience directly with any patients, but if you have worked in healthcare or if you've worked with children in the past, that's definitely a plus. If you are in school for psychology, even if you're still working on your bachelor's, you could still be considered for a position, even if you don't have any experience. And my biggest advice is when you do your resume to include any job or internship, volunteer, leadership experience you have, and any courses you've taken, any research you've conducted in the past is definitely very helpful when we're looking at resumes. Like I said, we'll hire you even if you don't have direct experience, but I do think in order to be in this field, you have to be able to learn quickly and you have to be able to ask questions. It's important definitely for your own career development, but if you're unsure of something, especially in this field, it can be really dangerous for our patients. So definitely important to be able to ask questions. Any experience you have as a mental health advocate or volunteer is also really helpful. We've seen a lot of people, especially recently, who have applied for positions who've volunteered with different organizations such as the Crisis Text Line. So any experience you have like that is helpful. People skills, helping others, being flexible. I think the most important thing we look for is passion for the work we do and our company's mission. Even though I don't work directly with patients, I get to hire the people that do. So mental health was something I definitely cared about. I think no matter where you work in this organization, whether you work for patients or not, you have something to do with providing that patient care. So I'll talk a little bit about the application process. So the biggest way that you can find open positions at Sheppard Pratt is on our website, which I listed there. It's sheppardpratt.org/careers. You can find all of our positions across the organization on that website. We do list a lot of our entry level positions on Indeed, so you can always search for us on Indeed. We have been trying to get better at using different tools such as Simplicity and Handshake. I know University of Maryland has their own career website, which I'm trying to navigate a little bit. We're trying to better utilize them so that we can share those positions a little bit easier. And another thing is you can also follow Sheppard Pratt on LinkedIn if you have a LinkedIn. A lot of times they'll share their popular positions onto their page. So that was kind of all I had for the presentation. So if anybody had any questions, I definitely have a lot of time to answer them.
Thank you, Stephanie. I think we do have some questions. Is that right, Michelle?
We do have some submitted questions. The first questions are these positions available for people with bachelor degrees, or is a master's required to be able to work?
Yeah, that's a great question. So for our mental health worker positions, the only requirement is actually a high school degree. With a lot of things changing with the pandemic, we've been seeing a lot more college students applying to these roles and getting hired for these roles. It's great if you have a bachelor's degree, but it's not required.
The second question was similar to that about the degree. So go ahead, Steve.
Stephanie, can you touch a little bit on the challenges and rewards of working at Sheppard Pratt?
Yeah, sure. So I'll start a little bit with the challenges. I think that the number one thing we see in this field is burnout. It happens so quickly. I think the people who work in this field are extremely passionate about the work that they do and helping others, and it's why they choose to go into this field. But with that, we definitely see a lot of employees who struggle to separate their work life and their home life. So we are aware of this. So we have been trying to do a little bit more about spreading information about different self-care techniques, and something that's really important to us is making sure that our staff is also getting the help that they need for their own mental health. We have an employee assistance program which offers free therapy to our employees. I think that you can get up to 6 sessions per year. And we are able to share other resources for other therapists in the area as well. And we're always sharing different resources, such as like the crisis text line is one we definitely share a lot. So I think that that's definitely the biggest challenge. I also think that in this field, it's really unpredictable. So things change in a second. So that's definitely something I've had to get used to. Some of the rewards, I mean, you get to help so many different people, and I just think that that's amazing. I hear about different things in our program, and I am just so proud to work for Sheppard Pratt. One good example is a lot of our residents put together this art showcase. It was called Art for Justice, and I went and it was incredible. I got to see all the amazing artwork that they did, and people wrote songs, they wrote poetry, they painted, they did a mural. And I don't always think about that side of things, but I just think it's so rewarding because you actually get to see the progress that like our patients and our residents make. So for me, that's definitely the biggest reward.
Michelle, I see we have some more questions.
Yes, we do. So the next question I have is, what does the salary look like for a mental health position, and what does the hiring process look like?
That's a really great question. We do have a salary structure that's set up so that we go based on your past education and your years of experience. So I'm not 100% sure what the ending pay range is for mental health workers is. I know if you're somebody who has a high school degree and has no experience, the position starts at $12.41 per hour. However, if you are in college, if you have your associates, obviously if you have your bachelor's, your pay rate is definitely going to be higher than that. And we take all kinds of different job experience into account when determining pay, such as if you worked in a daycare, if you were a babysitter, or if you worked in a hospital. We take all of that experience into account when determining pay. Another cool thing that we do is we offer shift differentials. So if you work on an evening shift, then you get an extra 75 cents per hour. If you work on the weekends, it's an extra 50 cents per hour. If you work a night shift, it's an extra $1 per hour. So that's kind of what the starting pay is for the position. And it's definitely a conversation we kind of have early on, because there is like a formula that the recruitment team follows when determining what the pay for the position is. As for the application process, if you were to apply for a position on our website and the recruiters look at your application, they decide that they're really interested, they want to move forward. We typically do a phone screen just to ask some questions about your past experience and tell you a little bit more in depth about the position and talk a lot about the unit that you've applied for to make sure that the population is a good fit. From there, you typically interview with a unit manager. A lot of them, even right now during COVID, are really great about offering share time. So you can actually come on the unit, you can meet the staff, you can see what the unit looks like and interact with the patients. So a lot of our unit managers are really good about that. That way, you know it's a good fit for you, and also they know it's a good fit for the unit. And we've had multiple instances where people go to a unit and they decide it's maybe not the right fit for them population wise, but we are all able to work together to find them a better population fit, which is really great. So that's a little bit about the position pay and the application process.
Okay, our next question is, how flexible are work or internship hours when completing a bachelor degree?
Yeah, we know that with school schedules, especially right now, we are definitely very flexible. When it comes to our counseling internship, the person who runs it, he has always run the internship program at Sheppard Pratt for the undergraduate students. And since we have a pretty big pool of interns, he is really great about going around other people's schedules to make sure that they're getting the hours they want and they need. So it's definitely a really great question.
Thank you for that. Are there any opportunities for internships for students who have already graduated that won't be able to do an internship for credit? Are there opportunities for students who are taking a gap year?
That's a really great question that I'm not 100% sure of the answer to, especially since right now with COVID, our internship program is changing. I know that, our internships are specifically for students who are looking for credit, but we do always have during not COVID times, we are trying to grow our shadowing programs and our mentorship programs and different things like that. A good example is I hired a mental health worker a few weeks ago who told me that she wanted to do her master's in occupational therapy and she wanted to work at Sheppard Pratt in the future. We hired her for this mental health worker position, and I reached out to the head of occupational therapy, and she's actually set up to shadow her one day on the unit when she's there. So we are definitely working to grow some of those programs, but right now things are a little bit uncertain with COVID.
So our next question is, in a mental health position, do you work with everyone or do you focus on a specific program or group?
Yeah, so for the most part, you do focus on the specific population that you're working with. However, in our hospitals, we have a lot of positions that we call float positions. In these roles, you get to experience different units and you kind of are scheduled to work where the need is. I know that you pick a few different service lines, like if you're interested in working with children and adolescents, or if you're interested in working for a Center for Eating Disorders, they will definitely make sure that they schedule you in those different units. But for the most part, you are pretty specialized in the group that you are working with.
So the next question is, how accommodating is the workplace for those who have physical limitation or certain health problems?
Yeah, it's a really great question. Our leave coordinator who handles all of the accommodations for everyone is really, really, really great at her job. And I say that obviously because she's my coworker, but also because I see how the employees interact with her. She does a lot of research on different accommodations and has a kind of a database that she has worked with other resources with to create, where if you plug in something, they will help give you options for different accommodations. Even for things like mental illness, she has a whole list. If somebody comes and they say, I have diagnosed anxiety, she has a whole list of different accommodations she can offer to them. So I do definitely think that we are pretty accommodating. We do have employees in the organization who do have different physical limitations, who do have different disabilities. So it's definitely something that we will work with you on.
Our next question is, what types of positions do schools hire for? And what type of training is received when working with students with disabilities? What are the safety protocols for these employees?
Yeah, those are great questions. So I guess I'll start with the training, because that's just kind of the first thing that comes to my mind, is that when you're doing anything clinical, or even in our schools, if you're working outside of anything that's pretty much admin, you go through a clinical orientation that's pretty intense. It's a 6-day orientation. And that sounds like a lot. However, you're paid through the entire orientation. And we want to make sure that when you leave orientation, you are understanding of what is the different protocols. So if you're not CPR trained, we make sure that you are. If you're not CPI trained, we make sure that you are. We make sure you're trained on how to use our documentation systems. We teach you different skills for the specific unit that you're going to be on. If you do decide to work on a unit, once you get to the unit, we do like a buddy system. So you'll get to mentor with another person who has been on the unit for a while, and they can kind of show you the ropes a little bit. That way you don't ever feel like we're just throwing you into an unsafe situation that we haven't prepared you for.
Great. So the next question, what path would you recommend for students just in the early stages of getting their psychology BA and looking to get into the mental health counseling?
Yeah, so I would suggest, looking into some of our direct care positions. We have our mental health workers, which I've talked a lot about because I recruit for them, but we have other positions that are working directly with students or with patients or with our residents. And like, for example, we have a case manager position in one of our community services that's really, really popular. And that's really great for starting to get your feet wet in the field and working with like coming up with different treatment plans. So I think that if you look into any of our direct care positions, it's a great way to start to prepare yourself for eventually going into counseling or a social worker or a mental health counseling role.
So we had a question submitted about benefits if you were to get a job at Sheppard Pratt, but also about tuition reimbursement for grad school.
Yeah, so benefits we offer health insurance, medical, dental, vision. If you work full-time, then you get paid time off. Depending on your position, it kind of determines on how much you get. But I will say that I had worked full-time before I came to Sheppard Pratt, and they give a very generous PTO package. It was really, really great. I never have to worry about taking time off. Even during COVID, they have been really, really great about making sure that if our employees are having to quarantine, that they are making sure they're getting the time off that they need and that they're getting paid throughout. That's a really great benefit. I talked a little bit about our employee assistance program. We have different counseling services through that program. We also have different things. For example, one of my coworkers just had a baby. She found her daycare through our employee assistance program. We have different financial counseling programs through there. You can find pet insurance providers. It's a lot of random stuff, but it's really, really helpful, and it's completely free. Even if you were in a part-time position, you have access to that program, which is really great. We do have a tuition reimbursement program. We're working on the process of standardizing it right now. And it's another one of those things where, depending on what role you're in, you're reimbursed differently. So for example, if you are a social worker or a nurse, you're going to be reimbursed a different amount than somebody who's maybe in a role like me, just because we want to make sure that our clinical staff are furthering their education. So we do have a tuition assistance program.
So our next question was, are there opportunities for research?
Yeah, it's funny. I've been getting a lot of questions like these, and I actually had to learn a little bit more about our research program so that I came prepared to answer it. So we do have a very small research program that we do hire research assistants for. We hire undergrads for this position, but it's not very common. I spoke to the person who runs the research program who said that in the future she is looking to expand this program. I do think that there will be more opportunities in the future, but I know that we do have a program right now. It's just maybe not as big as I thought it would be, but we do have that program.
We've had a few questions related to once you get into Sheppard Pratt, is there room for growth or how can they advance their career?
Yeah, so I talked a little bit about my journey that I started as an intern. I was able to get hired right out of my bachelor's. I've gotten promoted since then. And, that's my story, but there's a lot of other people throughout the organization who have the same story. A really great example is our previous CNO, who's like the top of the nursing department. She started at Sheppard Pratt many, many years before as a mental health worker. She went to nursing school. She wound up becoming a nurse. She became a unit manager. She worked her way all the way up to the top and was our CNO for a very long time. She worked at the organization for over 40 years. And other people have similar journeys as well. I definitely think there's a lot of room for growth in the company, especially since we are expanding, we are adding new programs, we're integrating with some of our other community services. I definitely think that if you're looking for growth, which I absolutely was, that this is a really great place for it.
So someone asked, what positions do you recommend for undergraduates students to apply for?
Yeah, great question. I feel like I've talked about our mental health worker positions a lot, so I won't talk about that as much, but it just kind of depends on what you're looking for. So if you, a good example is if maybe one day you're looking to go into school counseling, we have a lot of day schools. We hire educational assistants to help the students and help the teachers. We have one-on-one aides who work directly with their students. We have education and treatment assistants who help with writing their IEPs and their different treatment plans. So that's definitely a really great position if you're thinking about going into school counseling. And we have our residential counselors who work in our residential programs and help them with their day-to-day skills. Like in our adult programs, they help more with doing things around the house and teaching them how to cook and how to clean and how to keep up with themselves. In our adolescent programs, it's more about making sure that they are, because a lot of our adolescents who are in our programs have behavioral issues and mental illness. So kind of making sure that they have better coping skills and working on stress management. Those are just a few positions that I can think of off the top of my head that are really great for entry level, but also our case manager positions, I think I spoke a little bit about. Those are just a couple off the top of my head, but I know that there's definitely more.
So we had people submit a question about when they should apply. So I think twofold. One is should they apply for an internship? And if they are graduating in the spring, when should they apply?
Good question. So if you're applying for an internship, I would say, as soon as possible is fine. We post our internship positions typically the semester before we're going to have them. So right now we don't really have any posted because we're not really sure what we're doing. If it was non-COVID time, this would be the time that we would start to post our positions for the spring semester. When it comes to if you're graduating in the spring and you're looking for a position, I would say a good time to start applying would be about 6 to 8 weeks beforehand. So if you start to see positions that about 2 months before graduation, I say apply for it. And even if the manager is like, I really need somebody to start as soon as possible, at least we know that you're looking for a position. And when that time gets a little bit closer, it'll be easy for us to transfer you into a new position.
So the next question, are there any positions right now that are remote?
That is a great question. So our positions where you're working directly with patients are not remote. However, there are some more admin positions that can be remote. I, for the most part, work in the office, but I'm working from home today. I work from home maybe 1 or 2 days a week. So we do definitely have a lot of people who are working offsite and remotely, but anything with patients right now, they're still continuing to be on site.
So our next question, would you recommend students to get an internship while still in school and then apply for a full-time position after graduation, or applying for a job while still in undergrad?
It just kind of depends on your situation. I with internships, I was a student who couldn't afford to do an unpaid internship. So I think that it just kind of depends on what your situation is. If you have that ability to do an unpaid internship, that's great. Go ahead and do that. That experience is still amazing. But if you're somebody who is like, I really want to find a job, I really need to have a part-time job while I'm in school. I think that either one, I don't think one is necessarily better than the other. It just kind of depends on what your circumstances are.
Here's a good one when talking about COVID. How has the day-to-day of working at Sheppard Pratt in your position and more entry-level positions adapted to working under COVID-19?
Yeah, so it has definitely been a lot of changes. Things still change, I feel like, every single day. The first thing I'll talk about is we put in a lot more safety protocols. Every day when I go to the hospital, I'm screened. They ask me if I have any of these symptoms. If I've left the state in 2 weeks, they take my temperature. I have to wear a sticker the entire day. That way, if somebody comes in, that I can show that I was already screened for these symptoms. Our environmental services team hired a lot more people to make sure that they are continuously doing more cleanings of high touch areas in the hospital. Everybody's required to wear a mask. When it comes to the patients, one thing I always say is, we try our very best to make sure the patients are wearing their mask all day. It doesn't always happen. But the staff is absolutely required to, unless you are in your own office. Everywhere else in the hospital, you are required to wear a mask. We installed a lot more of those hand sanitizer kiosks. I already felt like we had a lot, but they doubled the amount that they installed in the hospital. When it comes to my role really changed when the pandemic was kind of at its height. When it started, I was still sitting at the front desk and fielding a lot of questions about our schools were closing. Am I getting paid during this time? And what if I have to quarantine for 2 weeks? And what if I'm sick? And here are my symptoms. Should I stay home? So it was a lot of fielding those types of questions. Right now, it's more, I feel like I'm getting a lot more questions about flexible schedules and flexible working, just because that's how the world has been now, is that it's something that's really important to a lot of people, especially people who have kids who are in school or who are in virtual school and trying to figure out their schedules and how they can work from home more and how they can have that work-life balance, because we'd rather work with somebody and make sure they have a flexible schedule than seeing them leave because they can't stick to a schedule because they have other things going on in their life.
Someone asked, are you able to apply for multiple positions at once?
Yes. One thing I will say is the system does have a limit on how many you can apply for at one time. I do think that limit is 5 positions within 30 days. But you can absolutely apply to multiple positions at one time.
Do you currently have any full-time positions posted?
Yeah, we have plenty of full-time positions posted if that's what you're looking for. We have a few part-time as well if you're more interested in part-time, but we pretty much always have full-time mental health worker positions posted and a lot of other full-time positions posted. So depending on what you're looking for, we have plenty of jobs posted that are full-time.
So I think that kind of covers all the questions. If anyone else has any questions they want to submit, please feel free.
I'll also put my contact information on there in case anybody does have any questions. That's my email address, my phone number. That's my LinkedIn. If you do have a LinkedIn, I share a lot of our positions, especially our entry-level positions. You can follow me, maybe just put a little note that says, hey, I saw you at the University of Maryland panel or whatever, something like that, just so that I know where you came from. But I do share a lot of our entry-level positions on there and just more information about the organization.
That was amazing, Stephanie. Thank you so much. I just have one additional question. I know we're living in a rapidly changing world, also in terms of how mental health services are provided and such. Is there ongoing training or any kind of ongoing education that's provided, like for mental health workers, to just keep them up to date on trends or changes in how services are implemented, that kind of thing?
Yeah, definitely. So we do a lot of different trainings. Even through the pandemic, we always had something called Wednesday lecture, which we would get a speaker to come in and talk about a different topic. They were typically a social worker or something like that, that you could go to. We had a couple of weeks where we didn't have it, but now we've moved them all virtually. Um, they talk about different topics. Like there was one a few weeks ago about specifically for people, for athletes who had suffered from injuries and were suffering with that kind of crisis in their life. So we do different things on different topics. One thing we've also done is we have done something on Facebook Live. It's called a Lunch and Learn. We'll do it on Fridays at noon. It's not every single Friday, but we do have a schedule. One of them they did a few weeks ago was about obsessive compulsive disorder and how to kind of manage that while you're in this pandemic where everything changes every single day and you don't have control over what's going on. They did one about mindfulness. They did one about just different self-care techniques. So we always have different trainings going on for our staff and also for our community. A lot of our employees talk at different panels about different topics. So like I said, if you follow Sheppard Pratt we're on Facebook, we're on Twitter, I think, our LinkedIn page, we're always sharing different types of things we're doing in the community.
Great. Michelle, I think we might have had one or two more questions trickle in. Is that right?
I think some of these have kind of been answered, but I guess one of the additional questions are about internships. Are they all unpaid?
They are, because we only are able to give internships for school credit because of the way that our agreements are. So that is a good question that I do get asked a lot. If you're looking for something paid, definitely something else to keep in mind is you're able to do an internship and still work part-time at Sheppard Pratt, which is something that I get a lot of questions about as well.
And I'll say for the Department of Psychology, we certainly support students doing internships. I would love to have another student at Sheppard Pratt. When I started in 2011, that was the last time I had a student as an intern at Sheppard Pratt. So I do want to say, Stephanie, this has been wonderful for us, for the department, and for the students getting reacquainted with Sheppard Pratt and all of the wonderful work that you folks are doing there. And so, as Stephanie said, we have listed her contact information. She's listed her contact information up there. And this is someone who has been in your shoes not too long ago herself. So I think sometimes the best folks for guidance and advice are those. So we look forward to continuing to work with Sheppard Pratt in any ways that we can support your mission and such. Please let us know. Michelle,
Yeah.
just a final look, any additional questions?
We do not have any additional questions.
All right. Well, thank you all for participating this afternoon. We really appreciate your time and spending your time with us. We hope that this was helpful for you, especially those of you that are looking to maybe go into specifically the clinical psychology field. So let's please give our virtual applause to Stephanie for all of the great information and knowledge and expertise that she has shared with us today. So thank you very much, Stephanie, and we wish all of you a health and safe day.
Awesome. Thank you so much for having me. I hope everyone has a great day.